Welcome everyone from around the globe. We're here at the Enneagram Global Summit 2021, and we're all learning together. There's a lot of self-discovery and a lot of support for well-being, physically, emotionally, mentally, and spiritually. And it is said, throughout many different cultures in different ways, little aphorisms that say something like, health is our best wealth. And so that is so true. And of course, the power of the Enneagram would eventually make its way into medicine. And I am just thrilled to be welcoming to this session 3 medical doctors who are going to talk to us about how the Enneagram has transformed their practices, brought them a better capability of working with their patients at different levels. First, we're going to be speaking with Dr. Avon Manney. Avon currently works with marine engineers, declaring them fit for duty at sea. She offers Enneagram consultations to those seeking to explore how patterns keep them stuck. And she co-facilitates group circles designed to help others gain insight from their energy systems, their embodied intelligence, their emotions and sensations while they are navigating their life transitions. Proudly, she is a descendant of Indigenous ancestors, some of whom became farmers here in America. She holds a medical degree with a specialty in physical medicine and osteopathy, and also has training in energy medicine, Reiki, shamanic healing. Personally and professionally, Avon integrates intuition and empathy and loves providing a holistic approach to health and healing for body and the soul. So glad to have you here, Dr. Avon Manney. Welcome.
Thank you, Jessica.
We're next going to be speaking to Dr. Steve Kanda. Dr. Steve is a wellness leader who founded the Mental Health Initiative for African Women, AfroFemme. And we spoke to her last year about this on the summit, and it was a really a highly acclaimed session. She is a medical doctor and a public health practitioner who has worked in Uganda, Kenya, and Zimbabwe, where she is coming in to us from right now. She developed the BRAVE, B-R-A-V-E framework, a tailor-made mental health intervention with 5 pillars of true strength for patients. And one of these pillars is the Enneagram. Welcome, Dr. Steve Kanda.
Thank you so much for having me back, Jessica. It's good to be here again.
Well, you're being very courageous talking to us at 1 a.m. because of your dedication. So thank you so much. I will also introduce at this time Dr. Jerome Lube. Dr. Jerome is a functional neurologist in Atlanta, Georgia, who specializes in childhood developmental disorders, vestibular rehabilitation, movement disorders, concussion, and brain injury rehabilitation. Dr. Jerome created and released the first ever neuroscience-based model of the Enneagram in his book, The Brain-Based Enneagram. Dr. Jerome Lube, welcome.
Thanks so much for having me, Jessica. It's a privilege. I appreciate the chance to be here.
Well, I also consider it a privilege to be with all 3 of you. And let us begin by talking with Avon. So Avon, I know that you like to create healing for the people that you work through an understanding of the undeniable interrelationship really, with the earth, the body, other people, divinity itself. How do you see the Enneagram opening the door for patients having, first of all, you could maybe tell us why it's so important to have all those things together, how it affects well-being, and how the Enneagram plays a pivotal role in being able to do that.
Yes. Well, I would like to start with just giving a background on the many things that I integrate into the practice working with people, whether it's with the Enneagram or from an osteopathic perspective. And so, just drawing from the background of osteopathic medicine, I would like to give a summary of the 4 tenets of osteopathic medicine, which also has, I can see, integrations into working with the centers as described and proposed based on the Enneagram model. So, in speaking of the first tenet of osteopathic medicine, where the body is considered to be a unit, and so the person is in union with the body, the mind, and the spirit based on this first tenet. So the Enneagram opens the door to connecting with our intelligence centers based on the triads of the head, the heart, and the belly center. And I'll be using the belly center and the body interchangeably here. And that being said, this also becomes a part of working with patients and having that perspective that there is union in the person based on the centers, based on the body, the mind, and the spirit, then the treatment can also be facilitated accordingly to that. And so personally working with the Enneagram and having this awareness that this individual is in connection with all of the other many relationships to themselves, the emotional body, the spiritual body, the sensations in their body. There is that unity, although there may have been a seemingly disconnection along the way, perhaps if any imbalances according to how they may be arriving at those with those intelligences, and if there's any interference based on any patterns that are running, they may not have available to them, making that mind, body, spirit connection. So if something is arising in the body that's presenting itself as a symptom of something, let's say that they're having some back pain, the back pain may have had origins in something that happened to them emotionally or something that happened to them physically, yes. So, so there may be a lot of interconnections that the person may not necessarily be aware of at the time that they are coming in to see me from a patient perspective, or even from a client perspective, depending on if I'm working with them with the Enneagram directly or as a patient. The second tenet of osteopathic medicine is that the body is capable of self-regulation, self-healing, as well as maintaining health. And it's always striving for homeostasis. And so the Enneagram can open the door again for seeing ourselves as a part of the natural world, as well as the spiritual world. Again, if there is an imbalance somewhere along the way where there isn't necessarily that perception of oneself and their body as having this means of self-healing, where there may not be a relationship with eating the right foods or getting enough rest and basically taking care of oneself, then there may be a means of there being a dysfunction along the way, or a dis-ease or a condition that can occur. So primarily here, we're integrating that there's also the energy of the body as well. And in some thoughts, the energy is the first immune system. And once the energy body has been compromised, then there can be it can be more easy for the physical body to have symptomatic issues arising in the body. And that also goes to say for the mind as well. And speaking of the mind, the many minds based on the nervous systems of the body, where there's the nervous system in the head, and then the cardiac system, and then you have the mesenteric system in the belly space. And all of this is comprises the body on the whole. For the third tenet of osteopathic medicine, which speaks to structure and function being interrelated reciprocally. So the Enneagram, in allowing for a means of navigating stressful experiences through an awareness of oneself and what's arising with them and how they are in relationship to their world. The identification that one may be taking on, as well as the behavior, can be reciprocally interrelated accordingly, tying into that third tenet where structure and function are interrelated.
Beautiful. So, Avon, do you find that when you are able to work directly, I mean, I know there's two ways of going about it. Your awareness and your knowledge about and your embodiment of the Enneagram can just inform your orientation and your ability to pay attention probably to more aspects of that patient. What I'm wondering is if the people that you're working with are actually working consciously, as you said, some of them do with the Enneagram, do you find that the sort of recognition, for instance, of the particular ways that they navigate stress from their type, of the recognition of that, and you're seeing them in that, so there's like a mirroring, mirror neurons and all that, helps in a sense relax them and make them more resilient to work through whatever problem they may be coming to you for?
Yes, and that certainly ties into the energy bodies that we all have, and may not necessarily be sensing into based on the senses of vision. Nevertheless, there can be an interchange there between my energy and the energy of the person who is also in the room with me, where essentially we are in a way becoming one body as we bring into the room this embodied awareness, and that as a person, there is no, and there being union and unity, where there is no separation within the body. So if there is something that is happening on one level, then the body, it can also come up in other ways, arriving in another part of the body in a particular way. So that being said, as one begins to have more information available, where they can read into their body sensations, if you will. And if there's something that is arising, say, in their heart center, where they're noticing something, and it becomes a means of deciphering a language, if you will. So the language of the heart, where one can tune in and be aware to that and be able to speak from that. Or if there's a sensation in the belly center, and there's something that's coming up there in the belly, where a person can recognize that this isn't to be taken for granted, that the body, it has or the centers rather, there are these languages, if you will, whereas one becomes more connected with their bodies, then they're able to speak more deeply from that particular center, in an aligned way. So the body being a unit where there is no separation, and when we can see ourselves in that way, and with our relationship within as well as our relationship outside, then there can be this more united way of expressing. And so not only will information become available when we are in alignment with our centers, but also we're able to sense into others' energy, if you will. There's like this bridging of bodies, where the communication can go through our energetic fields, and having experience, certainly with the hands-on work, there most certainly is this something that comes up when making that connection, whether it's a physical connection or whether it's an energetic connection.
Mhm. Beautiful. So you're saying that uniting the intelligences of the three centers creates, of course, access to things that people wouldn't know about themselves otherwise, because now they have more resources, they have more vantage points, more views, but then also interpersonally with their caregiver, there's like information that opens up between the two of you that can come from either of you that would help the health trajectory.
Yes. So for the downloading from the ethereal or the ether, if you will, and then the grounding with the earth, and having this connection, so above, below, and then horizontally, and being in relationship with others, and sensing into our own systems. There's also this collective field, if you will, where there's an opening to even more information.
What a beautiful model, Avon. And it's a really good place for this session to start, about just, the potency of how the Enneagram actually helps the caregiver and the patient see places that they haven't been accessing, and that when those open up, both internally and together, so much more can happen. I just love that whole sense of that's what the medical field could be. And I'd like to move over to Steve now, and Steve, to talk a little bit about that. So people do come to us, to you, looking for resolution of their pain. It may be mental pain, it may be physical pain, and of course, as Avon was just pointing out to us, those things could be resonant with each other. Have you found that different types respond to pain differently? And have you found that there's a way that, as a practitioner, you can guide the people who come to you knowing their type in certain ways that will help move them towards healing?
Absolutely, Jessica. I found over the course of this last year, I became somewhat of an Enneagram evangelist, where I was trying to reach people who've never heard about the Enneagram, and especially in the part of the world that I'm in, it's something which is still very new, and just trying to introduce people to what a transformative tool that it is. So in my line of work in healthcare as a GP, seeing patients and trying to answer the question, is your health affected by your Enneagram type? And the answer is absolutely, it does affect your health. It affects the way you respond to pain. It affects the way you seek healthcare. And we could use this to provide a healing guide, a form of kind of harnessing the strengths that each type has to better health. And what I did is we just looked at a sample and did a study where we tried to look at qualitatively what does that look like with each type. So I could just summarize some of those findings that we had, which were pretty interesting. But on seeing the results, it seems pretty obvious, and yet we're not using this in medicine and in healthcare. So I'll start off with our type 1s. Our type 1s were the patients who were chasing the perfect scores. They want results and everything to be perfect. So if you have a diabetic patient and you're aiming for a blood sugar of 7.1 for us millimoles per liter, they want 7.1, and they don't want anything even if it's along the range. No, they want a perfect score. And they would be always asking for their results and wanting to compare and see, am I in the right place? That do I fit in to the right picture of what health should look like? In terms of seeking healthcare, ones would always seek health care, but they want it to be the right location with the right fit, you know, ticking all the boxes in their imaginary what should be the perfect healthcare situation. And of course, scheduling appointments, making sure there are no delays, which would upset them and things like that. But some of the tools that we provided with our ones was realizing that just like nature, you don't have to be perfect to be healthy. You can have different trees, just looking at nature and the way that there's waves and tainting and all sorts of beauty that comes out of imperfections. Just knowing that being kinder to themselves, accepting themselves as they are, and focusing less on scores and results and more on how they actually feel, and if they are improving, if they feel better, and just being kinder to themselves. And then the 2s, obviously, guilty, taking time off work to see any healthcare, anything to do with themselves really makes them feel a bit uncomfortable, because they would rather someone else is being seen or someone else is being helped. So our 2s were often prone to neglect of themselves, even being concerned about the cost of their health care, being concerned that they're taking up space for someone else who might need help, or when they're away from work, that they're putting someone out for being away. So they had quite poor health-seeking care behaviors. And this could lead to them delaying and dealing with issues which could have been dealt with more quickly, but because of the way they are. So the guidance that we gave type 2s was to have some sort of alarm or a bell or something to remind them to check in with themselves, to realize that the more they spend looking after themselves, they'll be healthier to spend time looking after other people, be healthy enough to bring their best selves to others. We also saw that practices of solitude are very good for 2s, just knowing, putting themselves in a place of meditation and really looking in and figuring out what it is that they need more so than what the whole world needs. And then with 3s, so 3s are the leaders of stress and burnout. Although stress and burnout can happen with all types, we found that 3s didn't recognize burnout as easily because they just go and they go and they go. And they will only act on their health if it is in the way of accomplishing or achieving their goals. So they'll just stop when things are not moving anymore, like, oh, I have a broken leg, let me get some help. But with 3s, they also face that neglect of looking outside, looking at their goals and their to-do lists, instead of trying to prevent bad healthcare outcomes. But traditionally, 3s are high achievers. So when they do have goals and want to have a healthy lifestyle, they usually crush it. But they will be more motivated with goals. So if they want to lose weight or they want to be fitter, they're more motivated to work on it. But when you say, no, just lead a healthy lifestyle, if there's nothing, they'll be like, why? What do I like? Unless there's a goal to go for, they might not be so motivated. So the advice would give to them as a healing guide was get a balance between work and rest, and just put self-care at the forefront, and know that being healthier generally will make them more efficient, and they can prevent a lot of problems by just taking the time off to rest. And just before I continue, the stress arrows, where the stress arrows of each Enneagram type, that is where each type needs to go for positive health outcomes. So we always see the stress as something that's bad, like when I'm stressed, where do I go? And the integration arrow as a more positive direction. But you find like for the 3s going to their positive 9, where they can rest and harness the positive side of 9s, that is the healthy side. And for 2s going to their 8s, becoming more of an advocate for their health, becoming a little bit more aggressive about their health. So we found this pattern that in health, going to your stress direction was actually a positive thing. And then the 4s, so we found our 4s to be overthinkers, don't really accept everything they're told. They just need to process things a lot more. And they're a bit special. They will hope, I don't know if the word is hope, but having a positive diagnosis is something which may set them apart from others. And problems that they would face is feeling they're not being understood by their doctors, so they might keep seeking extra counsel and go into maybe more natural solutions. And the path that we advised for 4s was use that overthinking to connect and explain to your professional what exactly you're feeling. And they also have to kind of let go and accept help, that they may not know everything and they may not have everything processed in their head. So that is what we were advising. And then with our 5s don't think they need a doctor. They're pretty much their own doctor because they've read everything. And it's not about, it's not just about Google. they will do research, peer-reviewed journal research type of going so deep and probably knowing more than their doctor. So they don't see the need to go to a doctor. Most of the time they overanalyze, they research. But the problem with this is that because they think they're in control of their health, they take on too much responsibility. And when they actually need the help, it's difficult then to accept care and to accept help from any healthcare professional. They will be well informed, but at any given time, when someone is sick, they need help, and you can't explain your way out of some of these conditions. So we urge the fives to release control, accept help, and let go. Of course, be an advocate as they always are. But just accept help. And then the wings, the sixes on their side, very similar to fives, especially if they have wings of each other. So the sixes will Google like the fives, but not a rational kind of Googling. They will have that they're the neurotics of the Enneagram. So they're hypochondriacs. They will Google the worst case scenario, and that is them. Whatever the headache, if it's brain cancer, they have the malignancy, and it's the 1 in a billion chance, it's them. So six is very anxious, but when they are receiving help, they will be very loyal to their doctor. They will attend their sessions on time and be very responsive and make sure that they're taking their medication on time. So very reliable when it comes to that. So just as a healing guide, to try and prevent the anxiety, just to trust that whatever help they're getting is enough and they're doing the right thing, and possibly just trying to calm them down more into believing that this works and you'll be fine, and getting them centered more. And then with the sevens, we have issues with indulgence, and they will only seek health care when it's getting in the way of them doing or getting in the way of them having fun. The good thing about the Enneagram is most people have their wings to balance them out. So there's never going to be a seven who's just, I don't care about anything. They'll always either have the more grounded six wing or an eight who's a little bit more solid for that. So with sevens, we have issues with just avoiding pain generally. So they may not be aware that there's a problem because they're too busy focusing on the future, focusing on having fun, and that's where excess and all that comes in. So for sevens, try and use some of that energy for good, for your health. Would advise that, look, there are many different ways now to be healthy. We can have a marathon, new Peloton, whatever new adventure there is, would encourage them to harness all that energy into something beneficial for their health. And usually they do have high energy and they're able to attack any challenge as long as it's something new and something different. And then with the eights, they have the energy and the grit. They also are the type to only seek healthcare when they're dying, because they can go and go and go and go. And their mind as well as their body hides their pain. They may not know they're actually in pain until they're told that, that if something's happening. We've heard of stories of people walking around with inflamed appendixes for months with gallstones, and because they just don't want to face it and they're too busy. So they seek care when it's like the worst time possible, but they're also very good advocates of their care when they do seek it. So they will stand up for what their rights are, particularly in this side of the world where there's not a lot of advocacy for patient rights. So an eight will want to know what's happening to me, where am I going, is this allowed? And they'll question the medical doctor or the nurse to tears, and that's if they're in the hospital. And they're also good advocates as a caregiver with looking after relatives. So the guide to healing for an 8 would be using that energy to work out, to eat healthy, but maybe what they do need is a bit of a routine, some sort of regular checkups to know that every 6 months, please get checked out. Just get checked out. You never know, because if they're okay, they will never go then. They feel like they're fine. And finally, with our 9s, you never know with the 9 if they're sick, because they feel like they don't matter. They won't speak up for themselves. They can be also well balanced when they're healthy. They can be eating well and exercising well. But when they get sick only when there's disharmony. So with the 9, you'd want to help them put themselves first, and also try and advocate for themselves more, and realize that they're important too. Just know that all Enneagram types can be very healthy, extremely healthy. They all have it in them. But then you do find that when you're in an unhealthy stage, when maybe not so in a level of maturity, we can fall into these patterns. And we believe that as medical professionals, we can help our patients if we just understand some of these behaviors and understand what it will take to make this patient take their medication, especially for chronic issues like HIV and TB in this side of the world. So that was some of the work we've been doing, Jessica. I hope I didn't take too much time.
Dr. Steve, thank you so much for doing that work. I feel like this was a wealth of information, and you gave every type some medicine, some and I was just laughing, thinking of all the prescription pads in the world. And it's like some of these prescriptions to get written as a prescription for people would be such a wonderful thing. Thank you for that, for this inspiration. And I'm going to come over to Jerome now. And Jerome, you've had the lovely opportunity of hearing Avon and Steve, and you did write the first book about the Enneagram that was brain-based. And I know that you're a neurologist, you understand, tremendous amount about neuroscience, and you also understand about interpersonal neurobiology. And we've had Dr. Dan Siegel, the co-founder of Interpersonal Neurobiology, is on the summit. And I'm wondering what you would like to, so I imagine that you have an extremely integrative approach, both in terms of the Enneagram, where you're looking at type, you're looking at instincts, you're looking at centers, you're looking at, the inner lines, and you're looking at all of that as it pertains to neuroscience and also emotional wellness. And so take us on a little journey of how you approach working with people who, as a neurologist, I'm sure have very serious problems.
Yeah, no, I appreciate it. And for the sake of full transparency, I'm technically called a functional neurologist because my doctorate is in chiropractic. So I actually find a middle ground between Dr. Avon and Dr. C. So all my board certifications are postgraduate in neurology and all of the brain rehab. But it's actually really fun. I get to connect in spaces similar to where Dr. Avon is, because she's in osteopathy. And I'm also a GP or a PCP like Dr. C, seeing people as a first point of contact. But in the world of functional neurology, we're trying to say, look, you're coming in with something really complex. I went to 21 specialists over 9 years and spent $100,000 to get a diagnosis. And once I had that diagnosis, no one knew what to do with it. So how do we do wellness for complex cases, right? How do we do wholeness for complex cases? And that's the world that I live in. And to comment on that and connect a couple of dots that you mentioned that I think are fascinating is I love what Dr. Avon was saying in terms of this unitive approach, the holistic approach, the union approach, right? In so many ways, we know that the body has the capacity to heal itself or themselves, but it's oftentimes an issue of resource or fatigue. So philosophically, I wholeheartedly agree. This is one of the advents of so much contemporary medicine and so much contemporary healthcare, is that we're moving into the realm of not compartmentalizing a person into siloed pieces of who they are as a heart or a lung or a brain or a body. It's this is a human being with a lot of things going on. And I tell the patients that I get to connect with, you're allowed to have more than one problem. You're also allowed to have more than one solution, right? We've got a lot going on. It's complex. So honoring the whole person, right? And I can absolutely relate and appreciate with what Dr. C is saying. And one of the things that she said, I'm glad I was on mute and my video wasn't on because I'm clapping in the background here in the room. I have personally felt and said for ages that we are misunderstanding some of what's happening with the stress lines. Because if you think about it, I'm also board certified as a physical therapist, so chiropractic, physical therapy, functional neurology, and all those other things you mentioned. And one of the things that we've often misunderstood about the Enneagram is that if you're under stress, something must be wrong. But in order to build stamina or to actually functionally grow a muscle, you have to put that muscle under stress. It has to have a load and it has to bear more weight in order to actually develop into something that has stamina. It has resilience. You cannot build resilience as any type without engaging the stress type in order to grow in that area. So what she was saying about stress neurologically and clinically and from a scientific approach is wholeheartedly true. I absolutely agree with that. So I think some of the things that came to mind for me, especially connecting that with Dr. Stiegel, who I'll completely defer to, he's a bucket list for me. He's a mentor and a peer and somebody I respect deeply. When we start looking at this interpersonal neurobiology, especially with what Dr. Avon was saying, what does it look like as a provider to know the way that I step into the room based on someone's lead type, whatever their most significant fluency is, the language and the dialect that they speak with from their type standpoint should completely inform my bedside manner. What's the speed by which I talk? What is the volume by which I talk? How much information am I giving? Because if I have a conversation with a sexual 7 and I'm going to go through a diagnostic report, I better do that in a very succinct way because they've already checked out, right? But if I'm having a conversation with a self-preservation 5, I better make sure that I don't give them a superficial answer, or else they're going to perceive me as incompetent. They're not going to trust me because I don't know enough of what I'm saying and I haven't honored that they need an appropriate amount of information to feel safe, right? So it's really important when we start looking at all of these pieces to understand that I think one of the really comprehensive but succinct ways to look at it is as a patient or a provider or a caretaker or a family member, anybody that's in the conversation of healthcare, being able to consider how is my instinct playing into this or impacting it? How is my types impacting this? How is my intelligence center or sensors affecting this collectively? Those are going to completely change the way that I engage in this. And I think more than anything, especially with where we're going into looking at things from a holistic perspective, I think one of the fascinating things, which we won't have the time to unpack today, but I think it's going to make itself more evident as time comes, is that kind of like what Dr. C was saying about not forgetting or foregoing your stress path. It's a really profound positive opportunity if it's intentionally and safely engaged. I think if we start looking at types the same way that we look at instincts and intelligence centers, which is that you have leads, supports, and blinds, that if we start understanding what our supportive types are and what our blind spots are in our types, but they're all in the conversation, if we start understanding that everything is involved, everything is in this person, mentally, emotionally, physically, collectively, relationally, spiritually, if we start considering and respecting the whole, not just having a conversation with who tends to be leading the conversation, I think we're going to have a lot more significant opportunity to make some pretty comprehensive care and have pretty comprehensive care and make pretty comprehensive change. Because I'll land that by saying, a majority, almost all of the patients that I see are complex unresolved cases. I went to 21 specialists. I saw a significant number of very well-trained providers. But the reason I didn't get any better, and a reason a lot of the people who are coming in to see me are still struggling, is because all of those providers looked at them in silo. They looked at them compartmentalized. They looked at them in too distilled a fashion. They didn't step back and see them as a whole human being, mentally, emotionally, physically, relationally, spiritually. They saw them as a 5 who asks too many questions, or A2 who doesn't take care of themselves. Those things are what's leading the conversation, but oftentimes what's compromising the system overall lives somewhere else, and we've got to step back and look at the whole person. And I think there's some opportunities to do that.
Jerome, I don't even know where to begin. There's so many amazing invitations here. That last thing that you just said, it's hard for healthcare providers to acknowledge that they have biases.
Mhm.
And that they can get triggered. That's really an inference from what you were just saying. They can get triggered like in the way that a psychologist or psychiatrist transference and countertransference. You know, we all have blind spots. We reject certain aspects of self that other types might represent, and we might therefore have an easier time and with some temperaments. And maybe the danger there is that those temperaments might get slightly better care because they're getting a more mirrored and unitive approach.
Absolutely.
My God, so with everything that you're saying about the patient, I'm suddenly thinking about the training.
Absolutely.
Training of healthcare providers. What do you think about that?
I think it's really important. It's actually, I'm working through a residency program with some of the doctors that work with me. And one of the things that I have to help educate a young, white, cisgendered, heterosexual male with is that his confirmation bias with those demarcations is going to inform him in a completely different way. So helping him understand, it's not a question of helping you to know if you are going to have a racial bias. It's when do you notice that you have a racial bias? That is your confirmation bias, right? If he's in a situation where there's been great research that's done that a majority of the GPs in the US were under the impression that Black patients actually genetically and from an actual genetic standpoint just feel less pain, right? There's a majority of providers that ended up testing that when they were taking care of African-American and Black patients, that they just assumed they felt less pain genetically. Like, do we know that in the healthcare system, you're going to see, especially Black transgendered women are taken care of at the lowest effective rate, but that you're going to predispose to assuming and believing a white patient, especially a white female patient, at a higher standard than others. If we don't name those biases up front, I think that's probably one of the most important pieces. It's not just having the Enneagram as a resource to effectively see better into the patient. It's having the Enneagram as a resource to see more effectively about how we're taking care of someone as a provider, right? Because if I don't know what my triggers are, if I don't know what makes me uncomfortable, if I don't know what I'm avoiding, and that walks into the room and I have no self-awareness that that particular energy or that particular instinct, type, or center is in front of me, I don't know that my brain is going to automatically, from a survival strategy, from an interpersonal neurobiology, energetic standpoint, like Dr. Avon was talking about, it's going to start guarding intrinsically because it doesn't know the difference between perception and reality. It assumes that if I'm uncomfortable, then something must be wrong. But it's the fact that I'm unfamiliar and I'm not fluent in speaking the particular dialect or language of the body that's in front of me, because that's not my confirmation bias. So if the doctor doesn't recognize that they don't know how to speak self-preservation 5, or they don't know how to speak. How many doctors, especially white male doctors, don't have bedside manner? They don't have compassion because they're so high in 3 that they've left the building when it comes to compassion in a 4 space, and they have no idea how to answer clarifying questions in a 5 space because they're too busy in an 8 and a 7 to get the job done, right? It's like, that's important to know that if you have no patience and you're taking care of somebody who's waited 3 hours in your lobby because you have no idea how to take care of your time management, they walked into the room and it's the first time that they've had an opportunity to get in front of you because you have a 4-month wait list, and everything that you say in the next 8 minutes will decide whether or not they find hope again, right? That's important. If you don't recognize that when you're in front of a patient, you can't effectively help someone heal because you're not taking into consideration. It's not just a body with a diagnostic that you're providing. It's a human being who's trying to find mental stability, emotional relevance, physical resources, relationally connect to you because they've got 3 minutes to build rapport before you send them out the door. And then they've got to leave the room and ask whether or not they still believe in God because they still feel terrible every day, right? There's so much that's going on. So to your point, if the doctor is not taking into consideration how this applies to themselves and they're increasing their self-awareness, the effectiveness and the impact of their healthcare is intrinsically going to drop, especially if they don't evaluate their own confirmation bias.
Jerome, the magnitude of the impact of this is just, it's incredible. I mean, it's just mirror neurons going out in concentric circles all over the place. And yes, if you have a patient that is accommodating by temperament, and so maybe they're not asking the questions they would want to because they sense that, you're tense and busy.
Yeah.
So you don't give them enough information, or somebody who's asking a lot of questions because they need to regulate, their themselves because that's their temperament, but you find that annoying. The implications are incredible. And
huge.
In the very little bit of time we have, I just want to say, don't you think when you brought in the powerful point about, cultural bias and racial bias, gender bias, all of that, don't you think that the Enneagram could potentially, or do you think that it could potentially serve as a powerful lever for changing that whole system? Because if healthcare providers understood the universality of the Enneagram,
right,
and they were looking at people more from, centers of intelligence and, type fears and type essential qualities, that it would actually get underneath some of those other kinds of biases.
100%. Absolutely. And the interesting thing is the model that I ended up creating, which is called the whole identity model. It moves from personality type to identity profile. If somebody ends up taking the Ready, for instance, in the IVQ, which is a standardized test that I leverage, that particular result that I get, here's a really important thing. The information from those tests are not a diagnosis, they're a diagnostic. If you're in a clinical setting, there are three main things that every provider has to leverage to get a really, really effective outcome. They need the case history, which is relative and personal to that particular person. They need really good diagnostics, and they need a very good exam that they leverage together for clinical interpretation. So it's, what is that person telling me? What are the diagnostics telling me? And what is my clinical acumen telling me? All three of those things together give me a picture of what's happening to that person. So when I look at somebody's whole identity profile and I take all of that data, it lets me excavate all of that information just like a lab value would, just like a clinical exam would. And why that's so important when you're talking about how we change the nature of healthcare is you're leaning into the space of going, what am I missing? What are the blind spots? What am I not taking into consideration? Because I'm not seeing this person as a whole person. I'm just taking into consideration, and I'm sure Dr. Avon and Dr. C can understand this completely, is oftentimes providers are taking care of whatever is the most significant or the loudest symptom. And the symptom is a survival strategy. It's the body trying to do something supportive to move you into a direction to either pursue something that feels better or mitigate something that feels worse, right? Mitigate pain, pursue pleasure. But the reality is the loudest symptom isn't oftentimes the issue. It's just a consequence. And we end up spending years treating patients' compensations rather than the origin of what it is that they're actually working through. So I think when we start using the Enneagram as a really helpful clinical tool, and we go, am I taking someone's mental health into consideration, emotional health into consideration, physical health into consideration? The mental is the head, the emotional is the heart, the physical is the gut. Collectively, all of those things are working in a human being together in relationship. And that gives me the entire energetic or spiritual divine experience of that body in front of me. And to Dr. Avon's point that she mentioned a moment ago, I think this is one of the things where it's becoming more accessible from understanding how we're made. I recommend to everybody, if you didn't watch Dr. Siegel's, don't watch it because it's going to be good. But Whole Brain Child and Mindsight are two very, very helpful books. Anything that was written by Norman Deutsch, The Brain That Changes Itself and the Brain's Way of Healing, will let you know what's possible in terms of change. But the last point that I'll make is this is where we really have an opportunity for where the Enneagram lands practically, is we develop from the bottom up. We build our system. We manage from the top down in terms of how we engage, and then we specialize in terms of this lateralization is what it's technically called in the brain. So when we look at a human being, are we saying that there's something developmentally from a hardware standpoint that isn't working great? Is it structural? Is there something functionally from a management standpoint where we might be missing the way that there's a communication breakdown? Or is there a specialization that's not working where there's an issue with timing and sequence? Like, there's so many people that come into me, their diagnostics come back clean, their exams come back clean, nothing showing up on their lab work or their imaging. And they're like, but I feel profoundly symptomatic. Because structurally they're fine, functionally they're fine, but everything on stage is playing in the wrong time and sequence, and it's creating and producing profound discord, but they look fine and they test fine. So we got to look at structure, you got to look at function, and you have to look at timing or integration. And when doctors start doing that and leveraging all 3 intelligence centers, all 9 types, all 18 wings, all 3 instincts, all the subtypes, and we see what's high and low and what finds the middle ground, then we'll start to be able to really have some nuance about what it is that we target and how we are able to assist somebody in becoming more whole rather than constantly focusing on how they're broken. And I think that's really the future of where the Enneagram connects to healthcare.
Avon, Steve, and Jerome. Jerome just made a call for the future of healthcare, and I think you, the 3 of you together, have just demonstrated and transmitted what the future of healthcare could look like, where individuals are not afraid. In fact, they're looking forward to coming to work co-creatively and unitively with their healthcare providers, knowing that they will get personal attunement and they will probably attain a level of well-being that we may not even have imagined yet. I thank you profoundly. I feel sadness in my heart that we can't continue this conversation right at this moment, but we are going to continue this conversation. And we will make sure that our global audience can get to be a part of it. Avon, some final words from you?
Well, Jessica, I would certainly like to say that it, again, has been such a tremendous opportunity to be here and certainly sharing this time and space with Dr. Jerome and Dr. C as well, and on their journeys, and feeling a lot of companionship and camaraderie right now. And I thank all of you for the work that you're doing in the world. Thank you.
Steve.
I too would like to thank you, Jessica, for just having this platform where we can explore how health is affected by our Enneatypes and the direction of possibly how healthcare providers can look at health and how they can be trained in the future. It's been such an honor, and we definitely will continue this conversation after this. Thank you so much.
And Jerome.
And I'll echo Dr. C and Dr. Avon. Thank you so much for the opportunity and the privilege to be with you. And a big extra thank you to Dr. C for being with us when it's already past midnight for you, close to 2 a.m. if not past. But I think the final thought that I would leave is, especially based on what everybody's already shared, that you are innately capable of wholeness. This is not about being less broken. It's about becoming more whole. And I would look at what it feels like and what it looks like to find 3 to 5% improvement, just reasonable traction. And if you don't know what that looks like, lean into supporting your community or in the Enneagram community at large, and that wholeness will come.
Thank you, all 3 of you, and to the future, the conversation and healthcare. And here's to your health, everyone around the globe.